Welcome, everyone, to the fourth and final topic of our self-care in the time of COVID town hall series. So today's topic is about mental health care. I'm going to welcome our moderator for today, Dr. Tom Kelly. He is our licensed clinical psychologist and the director of clinical services. Welcome, Dr. Kelly.
Thank you, Sandy, and thank you for the introduction, and welcome everybody. I'm so glad that everybody could join us for our final session in our healthcare series in the time of COVID. Tonight, I have a great, very distinguished panel. I'm very excited to have everybody on board. So I'm going to start by introducing our panelists. First off, I'm going to introduce, we have Washti Akif Fakuri. He's a mental health clinician with extensive experience providing mental health services to diverse populations of individuals and groups, including those navigating intellectual developmental disabilities, co-occurring complex mental health vulnerabilities, and other concerns. Washti has been a member of the START network since September 2021, has served as clinical director for START programs based out of the following: California Regional Centers, Regional Center of the East Bay, San Andreas Regional Center, South Central Los Angeles Regional Center, and currently with Westside Regional Center. We also have with us Tiara Click, is the Therapeutic Coaching team lead. She has been with the START program for over a year now, a year and almost 6 months. And she introduces the START program has been a meaningful asset, increasing her knowledge of the IDD community. She has a graduate education with a focus towards counseling and psychology, and has made it her mission to work with people and expand their compassion towards and awareness of individuals with intellectual disabilities and co-occurring mental health diagnoses. We have Dr. Tracy Felice, and she has shifted fields initially from mastering in medical sciences, currently working as a psychologist, where she has an experience working with the USA veterans, worked in Skid Row, worked with the Greater West Los Angeles Veterans Administration, and recently she has joined the Westside California START team as a clinical director through the Exodus Recovery Program. Here she is providing support for individuals, especially those navigating intellectual developmental disabilities and their system. Dr. Tracy has worked throughout the age span and has experience in assessing an individual's medical history, resilience, and trauma. Dr. Tracy has also provided hours in family court advocacy for children and parents assisting for the betterment of the child. Finally, we have Dr. Nicole Alexander, who's a psychotherapist and life coach, and recently she has joined Exodus Recovery Incorporated and is also involved in Westside START program as a program director. She's a West LA native, born and raised in Westside Los Angeles, has been providing services and running programs for individuals with mental health disorders for over 20 years. Her areas of experience include evidence-based training in family therapy, family systems modality, positive psychology, and cognitive behavioral therapy. So welcome and thank you so much for joining me. We have a number of questions that were submitted to us from the community. To begin, since I've recently been referring to the START program, maybe we could start and just introduce, what is the START program?
Great. Well, hello, everybody. Thank you for having us. We're really excited to be here. And thank you, Dr. Kelly, for the introductions. START is unlike a lot of other mental health agencies that I've come across. We are a mental health support service for people with intellectual and developmental disabilities. And our goal really is for people with IDD and behavioral health needs to have as much stability as possible and to avoid crises that can really disrupt their lives. And we're unlike a lot of other agencies in the sense that we're a systems agency. Our work is really with systems of care and not direct services with the individuals. We don't replace anybody, but rather we really serve as bridges that connect, various islands, fragmented islands. That really often is a case for services. Our focus, again, is on working and supporting individuals and their support teams, their systems of care, and specifically individuals with intellectual and developmental disabilities and co-occurring complex mental health vulnerabilities. We really provide psychoeducation and training to various systems of care. And of course, we are a crisis response team and have a 24-hour-a-day, 7-day-a-week, 365-day-a-year crisis support line that any members of an individual system of support can call for additional help or guidance around navigating crises. We are very PERMA-focused, which I hope that we can get into that a little bit later on in this discussion. But in short, PERMA is an acronym for a model of well-being by Martin Seligman. And these 5 factors of PERMA are thought of as the most important building blocks for well-being and happiness. So we always say at START that an absence of mental health symptoms does not mean that you are happy. We need to also have PERMA, which is positive emotions, a sense of engagement and being completely absorbed in something that you actually enjoy, having authentic, connected relationships with other people, having a sense of purposefulness and meaning in your life, and of course having a sense of accomplishment and success. So we are a PERMA-focused crisis response team that really focuses on supporting systems of care who are supporting individuals with IDD and mental health vulnerabilities.
Thank you. And one of the things that had been mentioned in kind of introducing you, and I think you talked about, is the idea of therapeutic coaching. What do we mean by therapeutic coaching? What exactly does that mean?
Hi. So with therapeutic coaching, it's an extension of the work that the START coordinators do at our program. So a START coordinator would refer an individual and their system to therapeutic coaching so that we can come in and support the system in observing and creating appropriate interventions for their child or their loved one or the individual that the system interacts with the most frequently with those challenges. And once we can figure out what interventions work best, we begin to train the system and coach the system on how to use those interventions, how to reach those goals without the START team, so that eventually we can fade out and they can begin to build their capacity and be able to deal with challenging situations and learn a little more about their loved ones and gain some education and also provide them a sense of hope. Wajdi brought up PERMA, and PERMA is a great extension of therapeutic coaching. We want to come in and bring activities and bring hope and bring life and reassure everyone that there's light at the end of the tunnel, and here's how we can help you reach that. So our goal is to be there and to assist in that journey and eventually, like I said, fade out and allow the system of support to have those tools necessary in order to, keep their system together and remain with oxygen.
And I think that's something that we all look for right now, especially still in the midst of a global pandemic, is that idea of engagement and hope. And I know one of the questions that a lot of folks have is coaching still available with the COVID precautions still in place, many COVID precautions in place, although they're loosening. Are you still able to provide this service at this time?
Absolutely. So coaching is available 100%. If the family's comfortable, we can come out in person. If, the family's still not comfortable due to COVID precautions, we can definitely do them online. We would set up a Zoom and reach out to the system that way.
And what kind of preparations have you made in preparing to return to the field, like safety precautions and that, considering COVID?
I'll go ahead and pass that one to one of my colleagues.
Sure. So we actually adopted a procedure really to not only maintain the safety of the individuals and systems that we work with, but also to keep ourselves safe and as healthy as possible. So one of the aspects of our transition back into working in the field, in people's homes, like group homes, in hospitals, really out in the community, includes a survey that we actually we will call before the day of the appointment or the meeting. We would call and we would ask a series of questions related to COVID symptoms. Also, in terms of our team, everybody has been mandated and have already completed their entire series of COVID-19 vaccinations as well as boosters. So those are some of the ways in which we are really transitioning back and keeping everyone safe. Of course, we always have our PPE with us, our masks, our hand sanitizer, and other PPE as well.
So transitioning, we've been talking a little bit about START, but just general questions I think that the community has been asking. In general, are there therapists, support groups available to provide therapy support for children and adults now with developmental disabilities? For example, for individuals that have limited communication and may have significant anxiety as a result of the COVID pandemic.
Absolutely. It's
Absolutely.
a great question. Go ahead, please, Sierra.
Well, from a START perspective, we really utilize PERMA, as we said before, and we have a PERMA group on Thursdays that provide that therapeutic support. And many attendees that go to these groups have limited communication, but it provides a platform to promote that space for engagement, whatever it may look like, whatever the communication barriers may be, it will be accommodated. So for that, you would need to be a START participant, but that's the regional center, and we don't want to go down that. So, but anyway, so there are therapeutic services within the program, that can assist with enhancing that communication, such as, coping techniques for symptoms such as anxiety. But I would also look online, there's a good amount of support groups being facilitated, via Facebook and other social media platforms that really promote that engagement.
One family was asking, it said that my daughter's behaviors have escalated due to her anxiety over COVID. She has limited communication. Her expressive skills are very limited. What suggestions do you have to support her at home when she gets significant symptoms of anxiety?
Sure. So in terms of finding appropriate supports, I think that's going to be, it's a challenge to really find clinicians who are really not only comfortable but confident in really adapting, therapeutic strategies that would really be necessary in order to be adequately support individuals navigating IDD. For instance, what do I mean by the right clinician? Not only someone who knows how to adapt therapies, but also someone who has a good understanding around the role of executive functioning and specifically executive functioning challenges. So some of the ways that clinicians should be adapting their approaches when working with individuals with IDD around depression, anxiety, and other mental health challenges or vulnerabilities includes really slowing down. We know that individuals with IDD, many of them are really navigating challenges with executive functioning, whether that's working memory, planning and organization, impulse control. Adapting strategies might really even be like slowing down. When individuals have limited expressive communication fluency, a lot of people have limited expressive skills. And off the top of my head, the vast majority of my early clinical experience has been working with children. And one of the reasons why I think that I became comfortable and confident in adapting my approaches to meet the biopsychosocial needs of the individuals that I'm working with is really because I worked so much with children, and I had to really adapt things so that the therapy could be, so that I can meet the person where they're at. Sometimes instead of having a traditional psychotherapeutic session, one-on-one dialogue, for example, instead of doing that, we might really employ art therapies or different types of expressive arts therapies to fix that gap, or not fix that gap, but rather overcome that obstacle or hurdle around limited expressive skills. depression is a beast. It can certainly be very challenging to really support somebody who is depressed, especially when their expressive skills are so limited. And of course, other than seeking out services from a qualified psychotherapist who does have some experience working with individuals with IDD, I will revert back to this idea about we really need to ensure that individuals that we're supporting, our children, our cousins, our clients, we really want to ensure that we're facilitating PERMA in their lives. PERMA strategies, there's a wealth of evidence that would suggest that employing the various aspects of PERMA in making sure that an individual is surrounded by opportunities to experience positive emotions, having conversations about their favorite movies, the things that make them excited in life. That's the P for positive emotions. Making sure that whatever the individual is engaged in, they are completely absorbed in that activity or that engagement. One way we can do that is by really keeping tabs of, or really trying to inquire about the individual's interests, their strengths, the things that bring them joy into their life. When we have an opportunity to understand or get to know what someone enjoys in life, we can really use that and apply that into our work or into our day-to-day interactions with our loved ones, so that we can encourage increase in PERMA, and through that an increase in well-being and happiness. I continue making sure that we are setting up our loved ones, our clients, to success by making sure that they have opportunities to engage in meaningful relationships with other people. And not only having meaningful relationships, but also having a sense of meaning in their life and purposeful existence. What are we doing to encourage a sense of accomplishment and success in this individual's life? So when we really bring together these various aspects of PERMA, the positive emotions, engagement, relationships, meaning, and achievement, I'm not only saying this from my own experience, facilitating support sessions using PERMA, but there's a wealth of research that would suggest that this is actually a strategy that really helps support someone as they're navigating depression. So I would say PERMA, and making sure that we can figure out or find or connect with a support specialist who actually has an understanding of IDD and how IDD might change our understanding of other mental health vulnerabilities that we've come across.
Thank you. I mean, that's some great suggestions for folks, and with engagement and kind of how to adapt your input. Another specific question a family had, my son became germaphobic due to COVID, is obsessive about cleaning where he will go or eat, obsessively washes his hands, also demands our house is spotless. Do you have any recommendations for working with him around these concerns?
I'll take that. That's kind of my topic because I love the medical field, and anyone in the medical field can tell you germs. Yeah, we've been doing the 6-foot rule. So, with the whole germophobia, number one, we call that mysophobia, is basically an extreme fear of germs, right? And so that usually leads to basically OCD. All right. And that's obsessive compulsive disorder, in the fact that it started somewhere. So just to piggyback off of Wajdi, we do a lot of engagement with the individual and with the family. We kind of do that biopsychosocial to understand from the beginning, where is it coming from? Because usually with COVID, it kind of magnifies things, right? So it started somewhere. It could be anxiety with the family. It could be fear-related depression or anything of that nature. So we kind of like work together. I really want to emphasize that. Wajdi, Tiara, everyone at Start, we come together and we work together. So it's not just me trying to figure out what to do with this child or individual or adult. We kind of engage with the family. We ask a lot of questions, right? So if you ever come to Start, you will get a lot of questions, but it's not like you're being interrogated. They're fun questions, just trying to understand. And it also helps our families and the system say, I never thought about that. Wow, maybe it's not that. Maybe it's this, something that happened previous to the situation. So we take all of that into effect and we worked with the individual, after giving this psychoeducation of what it is and things of that nature. We work with the individual depending on age related. We're very good at that. So we're not going to give a, 25-year-old something that's for a 5-year-old, unless it's something fun in that way. So we pay attention to that and we help and understand, like I said, their fears, right? Because that goes back to the initial situation, their fears. And we look at situations of when is it most prevalent of feeling this way, and helping them maneuver through that, reframing situations that maybe parents or caregivers might say to intensify that anxiety. So these are kind of the avenues that we take to help that individual find their coping skills. So it's not our coping skills that we're putting on it. Like I wouldn't put mine and how I deal with that situation. We look at them, we look at their system, we look at the situation, we look at the biopsychosocial, and together we kind of form a better coping skill for the individual.
I also add that, I think it's also really critical for us to take into consideration the fact that we pretty much demanded that everyone does become, more vigilant, hypervigilant, if you will, around germs because of the pandemic. So what we know about, many individuals with intellectual and developmental disabilities, have executive functioning vulnerabilities. Again, whether that's working memory, planning, organization, impulse control, or whatnot, that really necessitates that we need to actually really slow down when we're transitioning back to, into the community. And I think that, we might have an expectation that we need to, transition faster from, life in the pandemic to normal life. However, what we know about this whole executive functioning is that that might, make it so that it takes more time and would require more support during that transition. And, of course, conversations, having conversations, making sure that people can anticipate changes is ideal. Many individuals with ASD, with autism, with IDD, really don't do well with sudden changes in their routine. So we really need to slow down a little bit, I think, and give people a little bit more time and extra support so that they can process this transition. But I will say that if it gets to the point where, someone's their fear of germs, their hypervigilance around germs is starting to impact their functionality, whether at work, at school, and life in general, then of course, as Dr. Tracy mentioned, we at START can of course provide some support. But if that individual is not necessarily a START client, then I would certainly encourage that family or that system to connect that individual with a clinician or a mental health specialist who can kind of maybe dive a little bit deeper and see how that might impact someone's life and really trying to move away from that towards a sense of wellness and well-being.
I think you bring up a really interesting point, and I think we probably all struggle with that. There's so many changes so rapidly as we're adjusting to new information, new requirements, new healthcare guidelines, which seem to change daily. And so I think you're absolutely right as far as processing that and how we, going into a store right now, I think a lot of people could probably identify, do I wear a mask? Do I not wear a mask? Are some of the people wearing masks? Are we supposed to wear a mask? And so I think absolutely is really processing that, taking the time for that. So I think that's a really good point, and thanks for bringing that out. Another question that we got from a family was that someone's daughter is going through depression and just talking about grieving the loss of her father during COVID, and started doing things that behaviors she did not do before. And again, has some expressive language limitations. And it seems like it's very hard to connect her to the right therapist that really can understand her. Suggestions about how to connect her to the right kind of therapy or the right kind of treatment?
Yes, I mean, that's really connected, I think, to one of my previous answers around finding the right clinician. It is, I'm still surprised, I would say even shocked at the size of the gap between appropriate service providers and the need. There's a huge gap, and there are very few psychotherapists who had specific training around working with individuals with intellectual and developmental disabilities and the mental health, the mood disorder like a depression, for example. I've asked this question to so many clinicians. Have you had even one full class during your graduate program around working with individuals with IDD or executive functioning challenges? And I don't think one person has said yes. So, a lot of clinicians clinicians that are great when working with individuals with IDD. A lot of those individuals really acquired their clinical acumen around IDD through experience. And there is a huge gap. It is very hard to find a therapist or any really mental health specialists that have this understanding that is the right fit. But with that being said, I think that's really changing a lot. It's really changing because of, for one, I think that even the START program, it's a national program. We're in several states all over the country. The START program does a really good job at advocating for individuals with IDD and co-occurring mental health vulnerabilities, and really communicating this gap to the larger community with the goal of filling it. But I understand also that your daughter is going through depression, and she, of course, faced a significant loss in her life because of COVID. And we can't wait, your daughter can't wait and should not wait until our society, can come up with a bunch of clinicians that are the right fit. So I think that it's necessary at this point to find the right clinician, ask the right questions, ask them, how are you going to plan to adapt your work with my daughter so that your work takes into sufficient consideration my daughter's biopsychosocial needs. For instance, how might that clinician adapt things? Again, I already mentioned slowing things down. I already mentioned, taking creative approaches, especially when expressive or receptive communication fluency is off, or challenged. So expressive arts types of therapies, I think, have been really successful. I will certainly emphasize this again. PERMA is an evidence-based support that really, there's a lot of evidence that would suggest that it actually helps alleviate symptoms of depression. So I would certainly make sure that your daughter does have not only the right clinician, but also those the P, the E, the R, the M, and the A. What opportunities does your daughter have to experience positive emotions? Is she, in a room by herself with the only thing to do is to color and she hates coloring, or does she or is she out in the community where she wants to be, for example, or even, having conversations with other people around things that make her feel good? Is she ever completely absorbed in an activity? Meaning, like, is she really truly engaged in what she's doing? And if not, how can we actually, facilitate activities or interactions with other people that do make her feel completely absorbed? Does she have meaningful, authentic relationships with other people? If not, there are a lot of other things that you can do other than purely clinical work to address that. For example, connecting her with peer groups, connecting her with opportunities, vocational opportunities. There's one individual that I think about often who really loved animals. And what we did, we really helped connect her with a vocational opportunity in a vet. So that's an opportunity, or an example rather, of making sure that there's meaning, purposeful existence, and a sense of achievement. Does she have a sense of accomplishment and success? If not, how can we set her up so that she can demonstrate her strengths and have a sense of achievement? So there's PERMA, there are community resources I would certainly look into. One of the most beautiful things about the internet is its ability to connect people from all over the world or all over the country in different regions in a pretty easy way. And of course, I would suggest that, especially in the context of COVID, there may be, it might be necessary to really, employ virtual types of supports, peer supports, or even formal supports. But of course, that might change and things might change again. And really making sure that we can, as we're doing that, really develop our field of practitioners so that becomes the norm and not the exception, that someone, a clinician, has that sufficient expertise or acumen around working with individuals with IDD, because everybody deserves to work with someone that is a good fit.
You mentioned supports, and I think that a lot of the questions come around grieving. Are you familiar with like grief support groups or anything like that that would be a good fit for the individuals we support, for family members? What recommendations would you give on different kind of like group support services?
Absolutely. So, a lot of those services and supports change a lot. So I guarantee you that since yesterday, or since last week, there has been an additional, support added, a community support or resource rather. Some of the ones that I've come across in my relatively short time in Los Angeles, the ARC I remember seeing that they had some peer support groups around grief and loss, and they were virtual. So the ARC is a good resource. There are other resources, and I think that many of them are attached to larger organizations or agencies that specifically work with individuals with IDD, including perhaps even the UCLA CANS Clinic. I know that some of their patients or clients have some opportunities for peer groups or groups around grief and loss. But I would also say that apart from community resources, I think we can see a lot of negative consequences that come from either not being able to or just not connecting someone with some grief and loss support. So if someone lost a close person in their life, and that can of course be a parent, it can be a friend, it can be a pet, it can be, and often is the case, it can be the loss of a paid support. So it's not only natural supports. And I think that when we ignore the grief and loss that individuals in this community or this population are experiencing, we can see a lot of negative consequences. So I would really encourage someone who, if your daughter is really struggling after this loss, or if anybody experience a loss, and many of us have, I would certainly encourage you guys to connect with a support, including even like a psychotherapist or another mental health specialist that can help you navigate it, because it is really challenging to navigate that by yourself, and it's even more challenging if you have additional vulnerabilities like many of the individuals that we support do.
In addition to what Wajid had mentioned, I also wanted to mention too, as far as like some like local support groups, like one of our, like to call them the ambassadors of like grief support groups here in the West Side, and you're probably familiar with them, but the Our House Grief Support Center is one, and then Open Path Counseling Center, and then like Loved Ones Victim Services, Jewish Bereavement Project, just to like name a few that's pretty like local here, in the West Side community. And if anyone would like, I can type in like the name of the places and the phone numbers in the chat, if that's helpful.
Yeah, if you don't mind, that'd be fantastic.
Not at all.
And I really wanted to emphasize a point that you made, Washi. I think is very important, is that we take the time and create the space for individuals to grieve. I think so often, especially in Western society, we have a desire to fix it, and we have to understand that grief is a process, and sometimes it's a long process, and that the time frame is different for everybody. But acknowledging, validating symptoms of grief, validating that feeling, recognizing it, and so when you see an unusual or different or changed behavior, is saying, I understand, you're sad. And it's also recognizing it's okay to be sad. It's okay to grieve. I think sometimes we want to kind of move past it. So I really like that, what you were saying is creating the space, creating the timing. And I think that that's very important, because, we really want to move past this. We want to move past the pandemic. I think all of us do. But that it's a process, and it's something that's not going to happen, and that there's a lot of feelings and emotions I think we've all been subjected to. So I really appreciate you guys making the points, and thank you for those supports. I think this is grief and loss is really an important subject. Another adult individual had asked if someone's requiring psychiatric hospitalization, they are adults. What role does the parent play in terms of making medical decisions once somebody is, like, we call it like 5150 or, psychiatric committal?
Oh, my mute button was stuck. Well, if the parents are legal guardians, because we must highlight that, and not only that, but legal medical decision makers, they can fully participate in the treatment of, their adult child. If they are not, the adult child would have to, consent them, which is done in the hospital, to participate in their care. A role will be deciding to take the recommendations that a doctor provides regards to meds. And when you're aligned with START, you don't have to feel alone in that. I think in the beginning, Wajdi was just explaining that there's information out there. And I know a lot of my friends that have, children that are experiencing these challenges. Sometimes you don't have the time to look up all this information. And sometimes you feel like information is not helpful. And, unless you really know. And so therefore, it feels good to have a support system behind. As Tiara said, we kind of help the system around it. So we're always helping on psychoeducation for the family so we can get the information. And I'm telling you, I don't know if anyone has ever felt depressed or anything. It feels good to just be like, here you go. Here is this, and here's this, and this is, and we have a team that has psychiatrists, and he's on top of it all the time looking at this. So anything that's new, we are on it. And that's what I love about START, because if you don't know that information and you feel kind of stuck or whatever, right? And you want to show your individual child or adult that, you got it, right? Because they look to you, and most of the time they're nonverbal, so they can feel any anxiety or anything coming from you. It feels good to just step out, get on a phone call and say, okay, this. Most of the time, if you're already enrolled in START, we have your collateral. We already have everything that's going on. We worked with you and things of that nature. So that makes it feel even better, because then we're able to say, okay, one moment, da 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 da, and we can tell you exactly what that individual, may need, or maybe this, or maybe, and just give you options to ask the medical doctor and to say, okay, well, what about this? And what happens if we decide to do this option or this option? So like I said, it's more or less being able to, one, be the actual legal guardian. So, or to allow your child or adult to feel comfortable that and you have a support system that can help you, get the answer that will help them in that situation. Because nobody wants to be in the hospital, right?
Definitely, and it can be very a helpless feeling, because the hospital administration then just sort of takes over, and you're kind of, so trying to get as much information. I think that was really a good idea for folks, is really trying to get as much information as you can. Another question I thought was a great question: how can I identify symptoms of anxiety, depression in individuals who are not verbally able to communicate their feelings or moods? So they're not telling you this or not communicating it. What are things that you look for to see if somebody's anxious or depressed?
With that, I would say pay attention to common patterns of behavior, or, common activities that they've engaged in. Are they now withdrawn? Are they no longer enjoying activities that they previously engaged in? Is there poor sleep hygiene? They're sleeping more or sleeping less, or, sporadic sleeping patterns. There could be a loss of appetite or even overeating. There's irritability. If you notice that they're losing their friends, just in a constant state of worry, or a constant state of worry about a task that they're about to engage in. It's important to use our observational skills when we are trying to identify what's going on in someone who has limited communication. So yeah, if they lack that verbal communication, you could also use visual charts or moods, so they can identify, either using colors or, writing down if they're able to read it. And they can use those sort of charts to point at what they're trying to get at, or how they're feeling, or kind of reach a point to where they can start to express themselves, and ask them to identify, where are you on this chart? We at START also can assist through assessments and tools and observations, in efforts to really identify those barriers, and the best way to overcome them. And like I said, those in-person observations are really helpful in identifying the best method of approach.
I'd like to also add on to that, oftentimes, people will come to us with behaviors, really presenting concerns, behaviors that need to be extinguished or fixed. And with that being said, I also think it's important to kind of reframe that. For me, presenting concerns are means of communication. So if someone is pacing around the room, for example, that may imply that this person's anxious, depending on how this specific individual, demonstrates that he or she is anxious. So really, as Tiara mentioned, observations are so important, because behaviors, the way someone presents, that in of itself, that is a means of communication. That is a way that someone can be communicating their various challenges, their pain, for example, their sadness, their anxiety. Did I mention pain? I mean, these are, you don't need to express yourself verbally in order to communicate your needs. And I think that one way we do that is by observations, like Tiara said. So let's not extinguish behaviors, let's understand them first.
Kind of following up on this, another question that came up is looking for warning signs of suicidal thinking in teenagers. There's been a lot of in the media, there's been a lot of concern about increased suicidal thinking, especially amongst young adolescents, young adults. Um, and I think everybody's kind of wondering, and especially for people that are not very verbal. So I think your what you're saying is well warranted. Is that observation pattern? What are some things that you'd be looking for that could be possible warning signs?
Sure. Tara mentioned one, some of the, criteria for depression, for instance, like being withdrawn or no longer wanting to engage in activities or interact with people that, they once enjoyed or enjoyed being around. Of course, for people who do use words to communicate, if your teenager is talking or even writing about suicide, for example, like making statements, even subtle ones, maybe at that point it would be that's a sign, a warning sign. Of course, withdrawing from social contact. A big one is increased or new use of substance use like alcohol or drugs. Feeling trapped or hopeless or feeling like they're in a helpless situation. Tierra already mentioned, some changes in, their eating or their sleeping patterns, doing risky or self-destructive things, for instance, is another warning sign or red flag that, a teenager might be suicidal. Giving away belongings for no reason or without, logical explanation. Having some personality changes or being really severely anxious or becoming really agitated, as Tara mentioned. Those are some of the warning signs that I would look out for. And what do you do at that point if you do suspect that your teenager is suicidal? I would first and foremost say that be human with your teenage child and validate their sadness, validate their pain, and with the goal of trying to understand it. It's really, really scary to be confronted about your suicidality in a way that could be even traumatizing. So really making sure that you're having that conversation or supporting your teenager in a way that is supportive, in a way that is it's okay and you have support and I care for you nonetheless. People who attempt suicide, they're really struggling. They have a huge sense of hopelessness. And one thing that we like to say at START, in terms of the types of support that we provide other people, we provide people oxygen. So when people are, when you express to someone that you're suicidal, I'd imagine that you'd want some oxygen to breathe. And provided oxygen in a way that is loving and caring and supportive. Of course, I would, if you suspect that your teenager is suicidal, I would absolutely encourage you to reach out to a mental health specialist. I can't imagine any schools that don't have a mental health specialist or don't have access to a mental health specialist. So you can, of course, use your child's or teenager's school as a resource. And also having an understanding or coming to a realization that perhaps you aren't the person that your teenager wants to talk about their suicidality with, or at least not the only person. So I would certainly encourage someone to get various streams of support, right? So not all support needs to be formal supports or paid supports. Natural supports it's magic. So I would say really making sure that you're not the only person that knows about it, right? Make sure that, all the various members of your teenager system of care or system of support have the information necessary to keep your teenager safe. I would also, really say that there are some great, other community resources, including hotlines. I tend to I hesitate to provide suicide hotline numbers on these types of meetings, because I need to call them and make sure that they still exist and that they're still working. So making sure that, whatever resource that you do provide your teenager, it's actually a resource that is helpful, and it's a resource that is still in existence and it's working. Paying attention, talking about mental health and suicide, or just around not necessarily the negative implications of mental health, but also about positive psychology and PERMA. Having these conversations earlier on is important, so you can really not only build rapport, but build a sense of comfort with your teenager around talking about things as serious as mental health and suicide.
And Wajdi, I just want to chime in on what you said about calling the hotlines prior to providing the number, because they may not work or what have you. But it's also important, because before you give it to someone, call the hotline and see how they respond. And, is this going to be a trigger for that person? Do you think that this hotline is a good fit for the individual you're linking them with, just to avoid any, unnecessary challenges?
So we're going to transition to an earlier, and I really appreciate that feedback, because I think this is a big concern for everybody, and we have seen a real spike in depression, anxiety. So these are, I think it's on everybody's mind. Another question that we had how about for young children? Are there mental health supports for young children? For example, children on the spectrum that may also be demonstrating some behavioral changes. What are some suggestions for working with young children?
I would be very mindful and aware that something called diagnostic overshadowing happens a lot in this population. If someone has autism, they have autism, and that's the only thing that they can have. And that, of course, is not true. Children and adults on the spectrum, for instance, who have autism, they can certainly have other, mental health vulnerabilities. We often say that anxiety travels with autism, and that's just one example that really contradicts the idea of diagnostic overshadowing. But to answer your question, I think that it really depends on the type of mental health support that is needed. And that's a really important point. It depends on the type of support. At START, we do our initial intake assessment. So we facilitate this assessment in collaboration with all the various people in the individual's life, so that we can so that this intake, this assessment, these conversations can inform our understanding about what the support needs are, right? So our intake assessment, for example, also utilizes a biopsychosocial approach to assessing support needs. So if we find out that somebody is navigating autism, depression, anxiety, and they're also diabetic, well, we need to take into consideration the biomedical vulnerabilities, like the diabetes. We need to take into consideration their psychological vulnerabilities and their social environments and potentially their social vulnerabilities. So when we take the time to actually study or inquire about the support needs, I think that we are in a much better position to actually connect someone with great services. Because if you connect somebody with great services, nothing might come from it if it's a service that's not the ideal service. So I would say that that's what we do at START, to really try to come up with a better understanding about what are the needs. Another really great option for people who are not enrolled in START is to have discussions or really even requests, support requests with your child's service coordinator at Regional Center. The regional center has a wealth of resources, which is great. But I think that that's a really important avenue is to really inquire with your service coordinator, your child's service coordinator at the regional center to really see what kinds of supports are out there. I will also add that making good use of community resources is also important. And like I mentioned, not all support is formal support. We can have less formal supports as well, including peer groups, for instance. And I feel like a broken record, but I think that this is also really that PERMA is also a really important and valid piece here as well. Are we ensuring that your child is experiencing PERMA? And if not, how can we adapt things in your child's life so that they can experience PERMA? And I will add one last thing that just like I'm sure most of us, if not all of us, have been on an airplane and have sat through those really boring safety announcements that before you put the oxygen mask on somebody else, you have to put it on yourself first. Why? Because you're not going to be able to help someone if you're passed out from lack of oxygen yourself. So I would really, I can't stress this enough, that an act of self-care for a caregiver is an act of caring for and supporting your child. So really making sure that you're also connected with the appropriate supports, whether those are formal or non-formal. I would add that.
It's interesting. I'm going to use that as a segue because another question is from a service provider asking, how do I support both my staff and the individuals we support who struggle with stress, anxiety, and burnout due to the pandemic? So that same consideration, not only caring for individuals that they support, but caring for the caregivers.
Yeah, a really good way to support staff would first be to pull, from an outside provider, such as a team building trainer, that's like specifically geared toward alleviating stress in the work environment, as well as providing those coping skills for the staff. And then those skills can be transferable in their work and through, to the clients. I would also say system meetings are highly beneficial in avoiding burnout. From the START perspective, providing oxygen, like Wajdi said, for one another, can really increase the quality of the workplace and improve well-being. And those sorts of meetings, I would try to check and make sure that there's someone who could facilitate, someone who's mentally prepared to provide that hope and positive engagement and perspective, going back to PERMA. Those sorts of meetings to check in, are really helpful. They're really helpful, and getting on the same page and pulling the system together just in one place. It would not only be helpful to support that system, holistically, but you can also collaborate on ideas that way and hopefully be able to decrease the workload of one another by divvying up tasks and saying, hey, this is where I'm lacking, or this is where I need assistance. This is where I'm burnt out. How can we share that with one another? And I think that it starts in the workplace. And if, the quality of well-being and quality of life and quality of work is good within the workplace, it will automatically be transferable to your work and to the clients and the individuals you serve. And it'll just come naturally in that way.
And I do want to just add on that, because that's my specialty with boundaries, especially putting the oxygen mask on yourself. We have to practice boundaries. I understand, especially as mothers, women, we already have that caregiving inside of us. And so it's like, we got to do this, we got to do this. And we forget about ourselves. Like, did we eat? And did we do this? Even in the workforce. So it is very important to understand boundaries and understanding you're just not being selfish or things of that nature, right? You're kind of making sure that you are giving enough oxygen, as Tiara said, and taking in your own oxygen, as Wajdi says, to make sure that not only the system is strong, but the people you're working with. And I always say, when I'm working with everyone, I don't care how stressed I am, you got to make it fun, and you got to do it with love.
And I would add, avoiding burnout is not selfish. And I would say, and yeah, I will say it, that it's to the contrary. What we know about the consequences of burnout or compassion fatigue as providers, it impacts the clients that we support. There is a wealth of research of evidence that would suggest that burnout is not good for the clients that we're supporting. So I would say that avoiding burnout, avoiding compassion fatigue, that those are instances of actually caring and supporting for your clients as well. Also, remind yourself that you are human, that your team is filled with a bunch of humans, and that it's okay to feel anxious, it's okay to feel burnt out. We have experienced one of the biggest shifts and transitions that are in a generation, in several generations. And it was stressful for most of us. So remind yourself that you're also a human and that you are in the midst of a very significant shift in this world. And that's okay to feel a little uneasy. It's okay to do that. And as Dr. Tracy and Tiara pointed out, it's important to have a sense of a team, a collaborative team, because one person is not going to be able to sufficiently care for another person. It takes a team, a multidisciplinary team of caring professionals and loved ones to really support somebody. So avoiding burnout, that's caring. That's true support for your clients.
Boy, Washti, I feel like my youngest daughter would really applaud you there if you'd seen me last night trying to get her through her homework page at the end of a long day. And my level of frustration that I needed a little self-care to be able to get to and patience, because it helps with patience for sure. So another question came up, and I don't know if you guys are aware of the research on this, but is there any research that suggests that COVID can lead to long-term mental health or neurologic complications?
Yeah, so there's a lot of new research, new studies that are investigating this. They're investigating long COVID, for instance. And I am by no means an expert on this, especially around COVID's impact on one's neurology. But there's a lot of evidence, especially one from a relatively recent study that looked at thousands of individuals who were diagnosed with COVID, and it looked at the connection between their COVID-19 infection and neurological and mental health symptoms or concerns. And there's a lot of evidence that would suggest that a huge percentage of people who were infected with COVID-19 have some level of impact and there are some theories about why that is. And one of the theories is that it might be related to inflammation in the brain, for example. It's very common with COVID-19. But apart from that, there has been some research suggesting that neurological conditions like strokes and seizures, sleep problems as well, and even some muscle weakness could be implicated by the COVID-19 vaccine. But again, this is pretty new information, new studies, new research. Definitely a lot of researchers have pointed to cognitive issues, for instance, like poor memory or difficulty finding words or having brain fog. Headaches, loss of taste and smell, a lot of these have been implicated by COVID-19. But even on the other hand of that, just experiencing this pandemic, navigating COVID-19 and all what that entails, A lot of people have, developed anxiety disorders and, other vulnerabilities, including depression that may stem either directly or indirectly from the pandemic and sheltering in place.
I think you raise a really good point. I think people forget about this, is that depression and anxiety can cause a lot of cognitive symptoms in and of itself, like problems with memory, attention, concentration, focus, all those things. So when we have that kind of cloudy effect, but this is not good news for me, Washti, because I'm already suffering from some loss in thinking skills. So it's only downhill for me. But all right, one other question that folks had been wondering about during the pandemic: many people remaining at home, limited social interaction, a lot of social isolation, and now all of a sudden we're transitioning back to normalcy, back to pre-COVID. But many are talking about noticing feelings of anxiousness when going into large public gatherings, completing simple tasks such as getting a haircut, going to a medical appointment. Are there medications, calming exercises, anything that you would suggest to kind of address this type of anxiety? And is there any thinking like, is this going to be long term? Are we going to have this anxiety with us for a long term?
No, I mean, it really makes sense. Like when we are threatened by something, we go into fight or flight mode so that we are ready to protect ourselves. Our brains are the same brains from like caveman times. So anxiety could be a really great thing. It helps us avoid being eaten by a bear or a lion, right? It drives this sense of hypervigilance, and that is necessary sometimes. So when we are threatened by something, we go into this fight or flight mode. And COVID-19 represents and represented and still represents a huge threat to our health, our loved ones' health, our well-being. So a lot of us will be in like fight or flight mode more often at this moment. And that's what really underlies feelings of anxiety. So in the short term, like if we're, approached by a bear, or we're trying to avoid someone who's coughing on public transport during a pandemic, it's going to be helpful to be in fight or flight mode so that we can spot the danger and be able to move quickly to where safety is. But, in the long term, being in this fight or flight mode is really exhausting. It is, and it can actually impact other systems in your body. It can impact your digestive system. It can impact your blood flow. It can impact your memory. It can impact your immune system. So during this time of COVID, staying on top of anxiety is really important, and it's key. And one thing that I would really encourage everyone who is experiencing this sense of anxiety, this post-pandemic anxiety, this post-shelter-in-place anxiety, is some of the strategies that can be employed might be slowing things down. It's okay if you don't feel comfortable to go to an indoor shopping mall with thousands of people. It's okay to do that. Not everybody is going to be able to transition back into a post-shelter-in-place society at the same rate as everybody else. I actually, I don't know when I would ever not use my mask. I feel like that's just going to be like a permanent part of my apparel from now on. Other people, that might not be the case. So I think that validating the anxiety and realizing that there's a reason why you are anxious about going back out into the community. It's because not that long ago, people were dying. Our loved ones were dying. Our friends were dying. Our colleagues were dying. Our neighbors were dying. And it did and does represent a major threat to our health and our well-being and our safety. But I did say that being in a state of long-term fight or flight response is not ideal. So ways that we can, some of the techniques and strategies that we can use to kind of get out of that mode and get back to our senses, if you will, there are a lot of different grounding techniques that you can use. I use probably all of these multiple times a day. I know that many of us have, heard of like breathing exercises and deep breathing exercises. Those are, really helpful for a lot of people. And you can adapt it so that it can be actually helpful, depending on who's using it. So for instance, if, young children do breathing exercises all the time. I actually, when I was a therapist for young children, like in elementary school, I actually made this little like mountain. It was like a pillow, but shaped in a mountain. And I would use that as a visual representation of breathing up. You go up the mountain to breathe. You're at the peak of the mountain, and then you slowly walk down the mountain. Other people, that would be really silly, and they don't want to do that. So really, you can adapt breathing activities and breathing exercises so that they're not, too childish, or so that they might be more geared towards a child. Other activities that I would suggest is using all your different senses. So one thing that I do probably every single day is Wajdi, look or find 5 things that you can see, 4 things that you can hear, 3 things that you can smell, 2 things that you can taste and whatnot, 1 thing that you can touch, and it actually gets us back into the present moment. Oftentimes anxiety, it's like you're really just hyper-focused on the future, right? So one technique to get us out of this fight or flight mode is to really get us back into the present moment. And that's a really good way to kind of focus your attention away from the anxiety-provoking content, is by really focusing your attention on other things, like things that you are in your immediate environment.
I just wanted to jump on that with the physiological, because I love that. That's the biology in me. And just understanding homeostasis and recognizing, just like Wajdi said, it's going to be different from one person to another. So we have to lower demands and expectations. And even though those can be skills that we can use for our children or even adults, we have to recognize that even that might be a demand. I remember helping one individual, one parent, and I was helping her and coaching her through basically a crisis situation. And she was just so concerned about the outcome. So that's fear, right? She's so concerned about the outcome that she just was like, oh my goodness, let me try to, get him over to this. Right. And it was very much like, you want to do this? Or do you think it's beautiful outside? And sometimes, we have to check in with ourselves. And I just want to, spotlight that. We have to check in with ourselves before working with other people. I can't say that enough. It's challenging at times to deal with different people and knowing where they are. So to kind of meet them where they are, you have to kind of understand, their demands and expectations, right? Sometimes it might just be quiet space before moving to the next learning curve, right? Sometimes it might just be validation. And I hear you. And I recognize where you are, or tell me a little bit about that. Okay. And just take a breather back and let them go through any of those feelings first, right? Because if you don't lower demands and expectations and to really understand that from one person to another, then yeah, you're going to have all the, what Wajdi was saying, blood and organs and everything. It's just going to lead to other things, right? Because the body is saying, I'm stressed out. So as long as you lower those demands and expectations, go back to, I always say in my practice, adults are just like children, right? And sometimes we just have to say, I understand, and take a step back. Sometimes all that education, I get you, and take a step back.
And with what both of you said, there's just been a really huge cultural shift with COVID. So I think, it's something that we have to try to accommodate and adjust to, and that's going to be challenging for all of us. But just culturally, we have to understand that the times are a little different. So expectations need to be altered.
Oh, great points, and I really appreciate all that input. One final thing that we had, and ironically, the question we have is, how does Westside Regional Center support their community with mental health resources and services? Who do I contact for help? I'm going to ask, Sandy had shared something with us that I didn't even realize we prepared, but there is a YouTube video that was put together with the Los Angeles Department of Mental Health and California START Services about accessing services and mental health supports for individuals in our community. So we're gonna put that in the chat. And fortunately, we have our whole START program here, and Sandy's also going to share in the chat how you can access the START services and everything that they bring. And you guys, I really appreciate you taking the time and answering these questions. We have a little more time left, and now I'm just going to kind of hand it over to the community. If you have any questions that you would like to ask to the panelists, to go ahead and put it in the Q&A box. And so any questions that you have that we haven't addressed?
Dr. Kelly, we had just a few questions come in during the presentation,
Okay.
and I will go in order. The first was Natasha, and she has her hand raised. So Natasha, I have unmuted, or you can unmute and ask your question. Natasha, if you want to unmute, you can ask your question.
I don't have a question. I think I pressed it by mistake. I'm so sorry.
Okay, no problem. Our next question was, let me scroll back up. Hold on just a minute. Are these programs available to Westside Regional Center clients who have other medical insurance?
Yes, absolutely. So one of the requirements to get services from START is to have, because we're contracted with Westside Regional Center, not only are we their collateral partners, their community partners, we also are contracted with them. And so if you do have services with the regional center, then their service coordinator can make a referral to us, and that's how service will get started. We'll, do our negotiation process.
And our next question actually came in Spanish, so I believe I'm going to need some assistance from one of our interpreters, if you can see that.
Yeah, I mean, going back to school, it's even if we were in a pandemic, for so many children, going back to school after a prolonged absence is anxiety provoking in of itself. But we know that this question is asked in the context of the pandemic and COVID-19, and I think that many people don't do well, especially when they're on the spectrum and they have ASD, for instance. A lot of individuals with ASD really struggle with unanticipated changes in their routine. So, one thing that I would really encourage anybody with children who are, transitioning back to in-person learning is to really take that into consideration. Take into consideration the fact that that it's going to be critical to actually have these conversations and to help them recognize that this change is going to occur, like a transition plan, if you will. I think the fact that rules and guidances were shifting and are shifting constantly can make that a little bit harder. But if there's any way that you can bring up these conversations around going back to school before actually going back to school, that might really decrease the intensity or the frequency of the anxiety or the depressive symptoms. I will also say that I would also use the school as a resource. Most schools have mental health specialists as well that can provide a lot of other additional resources. And yeah, 11 is also a hard age. So I would also, take into consideration, again, the biopsychosocial, other medical conditions that are going on. Could this be related to, puberty and menstruation, for example? Could this be, have something to do with um, another condition like, diabetes or a thyroid condition? What's going on socially? Does this person have friends at school? Did their friends go to a different school and now they're by themselves? So this is what we mean by really taking into consideration the whole picture, so that we can get a better understanding as to why your daughter is presenting like this right now.
And can I add something to Watch D, just to prepare for when that anxiety does kick in when she returns to school? I think it's important to observe at home. What is it that ever calms her down? Have you been able to observe what soothes her? And is that soothing option always available for her? Whether she's at home, at school, in the community, wherever she's going, and just teach her how to access that self-soothing.
I've definitely utilized anxiety plans. I worked within schools for quite some time, and many of the individuals that I worked with were really struggling with pretty debilitating anxiety, including social anxiety, and would have panic attacks, for example, at school, which would be many of them would express that was embarrassing to present like that in front of their peers and whatnot. So what I did is I actually, because of the fact that I knew that this person had anxiety and was struggling with anxiety, we collaborated and developed an anxiety plan. And some of these anxiety plans would even include a script. Like when you're having a panic attack, just whip out this script and read it. And it kind of is a script that would help guide you through or navigate you through this really challenging panic attack, for instance. So really being able to anticipate what the needs are going to be when the anxiety or the depression presentation is at its peak. Don't come up with solutions when we're already amidst the high intensity, high frequency depression and anxiety. Let's develop a plan beforehand so that we can anticipate barriers and try to overcome them before they become major crises.
Okay, I see no more questions in the chat and no hands raised. We do have one comment that came in from Joy McFarland. As a longtime provider, it is great to see that grief is being addressed. And that was the last. I see no more questions in the chat or no more hands raised.
Right.
One more thing came in. Oh, Sandy put something in. What does START stand for?
It's a California Systemic Therapeutic Assessment, Resources, and Treatment. But it's interesting. So not everybody knows this, but the systemic goes with all of it. The therapeutic work that we do, it's systemic. The assessments that we do, it's systemic. The resources that we provide are systemic. Everything, we work in systems. We work in collaborative teams. So that's START.
And you can never have enough acronyms in any system. So glad we have another one. Well, I really appreciate this panel. Thank you so much for joining us this evening. And I really appreciate our audience. And thank you so much for all the questions that you brought to us and to kind of help enliven this discussion. So thank you very much, and good evening, and so long.
Thank you.
Thank you.
Thanks, guys.